You've been dispatched to the scene of a 45-year-old male suffering from shortness of breath.
Alright, BSI, is my scene safe?
Your scene is safe.
The nature of illness seems to be shortness of breath. Is this my only patient?
Yes, it is.
Alright, I'm going to go ahead and request ALS backup. And, sir, can you tell me have you fallen or hit your head at all today?
No, I don't think I have.
No? Okay. Then we're not going to take C-spine precautions. My general impression of this patient is poor. However, he is alert and talking to me, so that would be an A on the AVPU scale. The chief complaint seems to be shortness of breath. Can I go ahead and get a respiratory rate and quality?
Sure. Respiratory rate is 24 per minute, and it is shallow.
24 and shallow, okay. I'm going to go ahead and hook this patient up to 15 liters per minute high flow oxygen via a non-rebreather mask to help alleviate some of that shortness of breath. Are you bleeding anywhere?
No.
No? Okay. What is the pulse rate?
The pulse rate is 125 beats per minute, strong and bounding.
Okay. And skin quality?
Is cool and diaphoretic.
Cool and diaphoretic. Okay, this patient seems to be exhibiting some of the signs and symptoms of shock, so we're going to continue with that oxygen therapy and also put a blanket on this patient just to keep them as warm as possible, conserve that heat. This is a high priority patient, so we're going to go ahead and transport immediately. Alright, so sir, what were you doing when this shortness of breath started?
Well, I was running a race, actually. I was running this 5K this morning.
Running a 5K, okay. Is there anything you do that really makes it harder for you to breathe?
Like any kind of movement, really, like even talking now makes it a little bit worse.
Okay. And how would you describe this difficulty? Is it like a tightening of the airway? Is it more like a...
Yeah, it's like tighter air, like I'm trying to suck my air through a straw almost.
Okay. And let's see. Would you say it's like in your chest or in your throat or...
Kind of both, mainly my chest, I guess.
Okay. And on a scale of 1 to 10, how would you rate your discomfort right now?
9.
9, alright. And you said this started about how long ago?
About 15 minutes ago, probably.
15 minutes. Okay. So just to clarify, you said it feels like you're trying to breathe through a straw. It feels mostly like it's in your chest, but also a little bit in your throat?
That's right.
Okay. Are you allergic to anything?
Allergic to aspirin.
Aspirin, okay. Do you currently take any medications or have a prescription for anything?
Yeah, I have a prescription for albuterol, but I don't have my... No, actually, I think my inhaler's in my backpack over there. I didn't remember it, but I think it's right over there, actually.
Lovely.
Great, here's my inhaler.
And has this happened to you before, this difficulty breathing?
Oh yeah, it's happened a lot of times.
Okay. Any other pertinent medical history I should know about?
I got a vasectomy a year ago.
Okay. And what was the last thing you had to eat or drink?
I had to eat or drink was... It's some like Powerade.
About how long ago?
About 10 minutes ago.
Okay.
They had some set up during the race.
Okay. And you said you were running a 5K. Did this start immediately when you started running, or kind
A
of
mile and a half in, right in the middle.
Mile and a half. All right. Alrighty then. I'm gonna go ahead and examine your chest and auscultate, listen for breath sounds. Do I hear anything abnormal?
Are you gonna actually examine my chest?
No.
Okay. No, you don't hear anything abnormal.
Okay. And I'm gonna go ahead and ask for a second set of vitals. Can I get a blood pressure?
My blood pressure is 130 over 105.
Okay. Pulse rate?
Pulse rate is 115, strong and bounding.
Okay. And respirations?
23, shallow.
Okay. My field impression of this patient is that it's poor. They seem to be having shortness of breath, possibly caused by an asthma attack. They do have a prescription for albuterol, so I'm going to call med control and ask permission to administer this albuterol, checking to make sure it is the right medication, right route, right dose, right patient, it's not expired. Yes, do I have permission to administer the medication? Great. We're going to administer this albuterol, holding the inhaler up to the patient's mouth. and asking them on the count of 3 to take a deep breath as I assist them in pressing down on the top of their inhaler. Okay. Has ALS arrived?
ALS has arrived.
All right. I'm going to tell them that I showed up on the scene of a 45-year-old male complaining of shortness of breath. Initially, he had a breath quality rate of 24 breaths per minute in shallow, so I started him on an NRB of oxygen at 15 liters per minute high flow. There was no possible C-spine injury. Pulse was 125, strong and bounding. He was exhibiting signs and symptoms of shock, so we continued oxygen therapy and gave him a blanket. He was running a 5K, and really he just started having this difficulty breathing. He complained of feeling like he was breathing through a straw. His last oral intake was Powerade about 10 minutes ago, and he did have a prescription for albuterol. He's allergic to aspirin. I called Med Control and asked for permission to administer his albuterol inhaler. I received that permission and assisted him in doing so. And his secondary vitals were blood pressure of 130/105, pulse of 115, strong and bounding, and respirations of 23 and shallow. I'm done with the station.